And I'm talking with Deanne Henson, and she happens to be the Director of Patient Care Programs for the BGH. And today we're going to talk a little bit about the cancer clinic that happens to be at our local hospital here. Deanne, welcome to the program. So nice to be able to talk to you. We're Zooming, of course.
Thank you, Doreen.
Okay, so today I wanted to talk to you about our cancer clinic, the different treatments that we can actually, we can go to BGH and have them right here in Brockville as opposed to going outside of Brockville. So I thought we would go step by step so that's for mine preference as opposed to our viewers. I'm sure they'll follow everything, but usually it's easier for me. So once a person it has been suspected that, yes, they have cancer, a biopsy has been taken, it's been confirmed. What's the next step after you've seen your doctor? Who do you see next?
That's going to be incredibly individualized for the patient and the type of cancer that they may have.
Okay.
But when Brockville will get involved is after they've been referred to the cancer care team in Kingston.
Yes.
At the Kingston Health Sciences, more commonly referred to still as Kingston General or KGH. So we are, Brockville General Hospital has a satellite site for cancer care from Kingston. So It's a satellite of Kingston. And they would then, the patient would still be seen in Kingston. They would still have their physician and their primary nurse and cancer care team would be located in Kingston.
Okay.
And at which point then, if they were receiving chemotherapy or immunotherapy medication that we can provide in Brockville, regimens that we could be, often it would be referred to as a regimen, that we could provide here in Brockville, then the Kingston team will refer the patient and they will just be scheduled to receive that care here with us in Brockville.
Okay, so they have to see the oncologist, then it has to be decided what treatment, and then whether or not that medication can actually be administered here at the cancer clinic, at the BGH?
Correct.
Yes.
Yep.
So
yep.
When we're talking about a team, then it's not here that the team resides. It's in the Kingston Hospital that the team would be. That's what I was confused.
We function as one very large team.
Okay.
Certainly, we work very closely. So in Kingston, there would be the cancer doctor or oncologist. There is a primary nurse that the patient would still see in Kingston.
Okay.
There is certainly allied health supports that specialize in cancer care located in Kingston. And the pharmacy, our pharmacist team and the pharmacy in which the medications are they're all sent from Kingston to Brockville.
Oh,
so all the chemotherapies and
okay.
immunotherapies, they're all prepared in Kingston.
Yes.
And sent to us every day in Brockville. And then in Brockville, the team here
yes.
Consists of the nurses that are specialized in cancer care and providing systemic treatment. So your chemotherapy or immunotherapy medications, as well as the supportive medications that really are there to support the side effects of the treatments.
Yes.
They're certainly specialized in that. We also in Brockville have a physician that is available to us and oversees our cancer care program here, but isn't the patient's primary
yes.
cancer care physician.
Yes, yes.
But they are there if ever needed, as well as we have a nurse practitioner that's involved in our program as well, if needed. So we very much function as one large cancer care team, and we just happen to be a site that individuals may receive some of that care.
Which is wonderful.
It wouldn't prevent people from ever needing to go back to Kingston. They would still be very much aligned, but it certainly can reduce the amount of trips back and forth significantly.
Yes, yes, and being so close to the BGH, it makes it a lot easier for individuals
Absolutely.
that live right here.
Yeah.
So Now, so the chemotherapy, depending on what type of cancer it is, that perhaps can be administered right here in Brockville. Whereas with radiation, that's definitely Kingston. No radiation is given here, correct?
That's correct. Yeah, that's
all right.
correct.
I wanted to make sure about that. Now, surgery, again, depending on the type of cancer it is, can surgery be done here in Brockville?
There certainly are surgeries completed in Brockville that may be related to cancer. Depending on what that is, there is some specialized surgeries that may not be able to take place in Brockville, but we certainly are involved in doing surgeries here. So it's reasonable to think that that surgery would be completed here potentially, depending on the type of cancer one is being diagnosed with, and then if referred then to Kingston for cancer care, ongoing treatment, then certainly coming back and receiving systemic treatment with us, so chemotherapy, immunotherapy type of treatment with us in Brockville.
So the chemo treatments, for some patients it would be every day. For other patients it may not. It may vary.
Certainly, it varies depending on there's many factors, and I wouldn't begin to explain them. But certainly, yes, there's always going to be a treatment cycle. So, that may be a number of days in a row, and then a period of time off between intervention, or it may be once a week. It really very much depends on that review by the oncologist and cancer care team to best address the cancer that someone's been diagnosed with.
How important is a caregiver?
So important. Absolutely. It's someone that, cancer can be isolating. We definitely pay attention to that in cancer care across the team. We want to be mindful of how people are doing emotionally, and we would encourage people to bring their caregiver with them. And we've currently designed and updated our space for to receive treatment in Brockville, to try to ensure that we have the space available for people to have their caregiver come with them, and we would encourage that, absolutely.
Okay, I didn't realize that. I thought it was just the patient that would go in to receive whatever medication they are supposed to receive. So the caregiver can actually be present.
Absolutely. Yeah, certainly we've had dark times during restrictions in visiting at times, but with respect to when we went through the pandemic. But yes, we would encourage people to have someone with them. Yeah.
So the type of cancers that would be treated here in Brockville, would we be talking about like breast cancer?
Yeah, certainly could be.
Okay. The more difficult ones, as you had mentioned, do go to Kingston to be assessed there.
So how we determine whether or not a patient can receive treatment in Brockville, I think it's really important to know that it's not so much the cancer as the type of treatment that's being provided to address that cancer. So that is something that we are continuously everywhere in cancer care is continuously adding on different treatments. It's certainly a growing area in healthcare in general. Yes. But we will continuously develop our expertise in taking on new regimens that can be provided by the team here in Brockville. And it really is dependent not so much on the cancer. So if you have breast cancer as an example, but we don't have that specific regimen that can be provided in Brockville at this time, then an individual would stay within Kingston.
Okay.
Whereas if the regimen or treatments that are being received is something that can be provided in Brockville, then they would automatically, if they're from this area, receive that care in Brockville.
Okay.
So I don't want to leave anyone feeling that's something that would be based on the actual cancer, because it really is dependent on the treatment. And if we can do it here, we will be.
I see. Okay. That makes sense to me now, because I always thought it was dependent on the type of cancer. So thank you for that explanation. Yeah. And is there anything else that you would like our viewers to know about the cancer clinic here at BGH?
I do think it's important for people to be aware. Obviously, when being referred to a cancer care provider, it's an incredibly personal decision, the one that you would make with your healthcare team. But what Brockville General is aligned as a satellite site of Kingston. So we very much will, as I said, provide any treatments that we're able based on your location if you are aligned to the cancer care team in Kingston. If individuals are referred to Ottawa, we do not have a satellite arrangement with Ottawa, and unfortunately, patients would not be able to receive cancer care at Brockville General as a satellite from Ottawa.
Thank you very, very much. And also thank the team for us here in Brockville and in Kingston for all that they do, because it's very, very important and it's very much appreciated.
Thank you, Doreen. I appreciate you having me today, and I'm happy to share information anytime. And I should also let you know that we do have more information about cancer care on our Brockville General Hospital website. We have links to the information through Kingston. So just going to brockvillegeneralhospital.ca and searching cancer care will provide you additional information if you're interested. Thank you so much.
Thank you. You take care.